Hey! What?
The lift wasn't working and he was in pain, so I tried to lift him on my own. Yes, it's bad. I'll need help.
Can I help you with that?
No, I'm good. Thanks.
Workplace injuries hurt the most at home.
Hello, everybody. My name is Jason Piercey, and this is Out of the Fog. From my living room, especially excited about the show that we have put together for you today, because it's all about reintegration and how to get back to work and to open your business up again, keeping yourself, keeping your clients, keeping your employees, and everybody around you safe. So we're going to have a conversation with Nurse June, who has become sort of our local COVID expert ever since we started talking about this a couple of months back. And then we're going to have a conversation with Brenda O'Reilly, who of course is a big local business owner, restaurants, bars, all of that kind of stuff, big tourism, and how all of that, including the stuff we're talking about downtown, is going to affect things moving forward. It's going to be a good show. We'll be right back after this.
Tell me about yourself. What are your hobbies?
I know how to sing and dance, baby.
Slice has you covered.
Oh, there's my girl!
Your favorite reality.
Both of us would do anything for a buck.
Absolutely.
Okay.
I can handle anything, even those housewives.
This is why I charter a yacht.
Your favorite movies.
Cheers.
Yay.
Wow. What? Jealous.
All in one place.
I am a yes.
On Slice, now in free preview.
This is Rogers TV.
And welcome back to Out of the Fog. Ladies and gentlemen, the wonderfully talented, and what a nice shade of lipstick, June.
Thank you very much. First time I've had on makeup in weeks, so I said I'm going to go all out.
I'm gonna get dressed up. Yeah, I didn't do any makeup, but I do have my lights. So this is June Tavenor, of course, with Catalyst Health Solutions. You've sort of been our go-to COVID consultant.
Yes.
We'll say, ever since the first days when your professional opinion was that it was fine and we didn't have the problem.
Yeah, those were my Trump days, I guess. I don't know.
Yeah. Yeah. And things obviously have changed, but we're de-escalating the degree of severity of our state of emergency, where we went from 5 to 4, and provided things go well over the next, what would you say, 3 more weeks?
2 more weeks. June the 8th is, if everything goes according to plan, that's the next phase day.
And then we'll go into 3. Going into level 3 is really exciting for a lot of people. They get to go back to work, they can open their businesses up again, but it's also a really stressful time because, I mean, we're waiting out COVID, but we're not waiting out the new rules of life.
Right.
And reintegrating, keeping yourself, your employees, your consumers, your customers, your clientele, everybody safe is now a totally different process than it would have been before. So that's what we're going to talk about.
Yeah.
So is that enough? You're like a little energizer bunny. Is that enough to wind you up? You can start going now?
Yeah, you're going to want to cut me off because I've got a lot to say about this.
Okay, well, you got 9 minutes. Go.
Oh, my gracious. Even just earlier today, listening to Patty Daly, who I think is killing it every morning on the old open line there. But again, it was more people who were asking, when is the government going to start coming out with the plan for how I reopen? When's the government going to start saying, what do I need, telling me what to do so that I can get back to business? And it gets to me where I'm like, guys, you know what? We need to come up with the plan ourselves.
Yeah.
So my business needed to evolve to be able to, and of course I was open during the whole process based on what we do, but I had to put procedures and policies in place so that, some control measures to make sure that my girls weren't bringing around extra viruses where it wasn't necessary and that sort of thing.
Well,
so,
I had to send for a viewing because I'm still doing some real estate stuff, albeit like lesser. Not because the business isn't there, because it's been busy, but I had to get my clients to sign a waiver saying they know they're going into a house that's occupied. The people in the house are saying that we're clean, but you're signing this saying that you have not been out of the province, you've not been in contact with somebody, you've been bubbling and social distancing the way you're supposed to be. And so we're all signing disclosure agreements to that effect.
So really what that is that's a really good example of an administrative control. So that's something that an employer or an industry can put in place, paperwork, if you will, to mitigate the amount of exposure that could be propping up in a situation like showing a house, or, as we progress now going into a restaurant, or what's the bar association going to look like, that sort of thing. And bar association, I mean like bars downtown, like George Street, not the lawyers. They can do their own thing.
Exactly. So, well, it's funny you should mention George Street. I've taken the habit recently because I'm doing these interviews from my home, and I'm not waiting on studio time and scheduling it a little bit different the way we always have at Rogers. I look forward to getting back to that setting, but I like the control that comes with this. I'm doing like a Facebook Live ahead of time to get questions that people might have to relay to an expert. I did it with Dr. Haggie. I did it with Dwight Ball. I did it with the Mayor Breen, and I did it with Nurse June. So people ask, like, how are we going to open George Street? How is that even possible?
Right. So that's the thing of it, is you need to take into consideration the context, what historically has been of being like the more popular places to congregate within a club down on George Street, or even like think about the outdoor festivals. How can we need to start getting creative with how we're utilizing that outdoor space. And I know one of the suggestions that's come out is very similar to the European model, where they're actually taking advantage of the outdoor spaces, which it's sad. We really don't take advantage of that enough. Anywhere else you'll see patio weather and everyone's on the patios and stuff, right? So that's a really good point and that's an engineering control though. So again, going back to how you actually develop your safety plan, the engineering controls now are going to be the physical barriers or signage to indicate spacing, one-way entrance and one-way exit, those sorts of controls that you can put in place that direct the physical environment of the workspace or the entertainment space. And those are engineering controls and how you can plan for reopening. Because again, if an organization can come up with a good plan and submit it to government, they might get permission to open a little bit early. They're going to do that on a case-by-case basis. But that's an option to businesses that I don't think they realize.
Yeah, I was talking to Sam Picco, obviously. She's not a stranger to Rogers TV, friend of mine, co-host of Sam and Jason Live, and she owns the Studio Beauty Bar. So they do hair, nails, eyebrows, makeup, all like very, very like close up sort of business. And
you should have seen the struggle I had getting this hair up today. I tell you what, the bangs growing out has been a problem, man.
Yeah, mine too. Mine are, I can grab it now. So anyway, Sam was saying that like she bought PPE, she bought shields for the girls, and she put up partitions because it's always been a wide open space, but she put up partitions and she's getting ready to go. But she did that because she's like a purebred entrepreneur. She didn't wait for somebody to say, hey, what am I going to do?
Right. And that's great. And the next step that she should take in other industries similar to that is to actually create a formalized plan. This is the plan. These are the measures we've taken and what will be the policies and procedures as we begin to open. Here, Dr. Fitzgerald and colleagues, is this acceptable? Can we get away with maybe having a few weeks shaved off our downtime so that we can actually get back to work?
And that's something that is available to people. They don't realize it. Like if you have a plan in place and you could submit it for approval and...
That's right. Actually, Dr. Fitzgerald made reference to it on one of the daily updates, but I think it's sort of passed everybody by because I've mentioned it to other people. Yeah. I've mentioned it to other people and they're still doing the whole, what can the government do for me?
So what can I do if I'm a restaurateur?
Okay.
And
so
now, obviously I'm doing drop off and pick up as much as I can, but to get people in, because I don't know if a lot of people realize that there's very, very slim margins in the restaurant business. The food business is not an easy one, and they make a lot of their money off of alcohol and drink sales.
That's right.
So they want to get people in the door. So what do I do if that's me?
So the three things that need to be taken into consideration are, again, administrative controls, some sort of a disclaimer, like very similar to what you described, before going into a house showing, so that the patrons that are coming in are giving that sort of disclosure to say, no, I am not a risk as far as I know. Then there's also the environmental controls, the engineering controls, as I mentioned, about, having what capacity. Now, that will very much depend on the layout of the restaurant. The Keg versus Bagel Cafe are very two different spaces. So, but then there's also the personal protective controls that you need to be able to provide to not just your staff, but then also to patrons that are there. So hand washing stations, cleaning schedules for things that are very frequent, high touch surfaces. The bathroom cleaning schedule is going to be ramped up for sure. There's things that need to go into the plan like that. But then also you need to be able to base it on some evidence. So this is not just suggestions that I'm thinking because, I've been in this situation for 7 weeks sort of a thing, but based on the guidelines that the PHAC, which is the Public Health Agency of Canada, what Dr. Fitzgerald is putting out, and also what the World Health Organization is putting out, that's why this is the plan that I've developed. And of course, you can have a volley back and forth with government about what it is that needs to look like, so that to tighten it up, to really say, this is what we're doing.
Do I have the option to open my restaurant early if my plan is airtight?
If it's airtight and they agree to it, yes.
See, I don't think anybody knows that. I really don't think anybody knows that.
That's right. And so this is what I'm saying.
Yeah, after this conversation with you, the other half of this show is going to be with Brenda O'Reilly. And so I think it would be really cool to bounce her thought process and yours together and mesh them, because everything you're saying is all the stuff that she's planning and thinking. And I think it'll be interesting for the audience. So in the next minute, how would you wrap this up for people who are going back to work?
I think that it's time we all start accepting the fact that COVID is going to be around for a while. It might mean how we're changing the way that we work, how we change the way it's going to mean we change how we interact with everybody else. But really, it's time now. The caseload is low. It's obviously not gone. The virus is here. You know what I mean? But this 7 or 8 weeks that we've just spent with increased hand washing, cough and sneeze etiquette, wearing a surgical mask to protect others, if everybody is doing that, that really has impact. So when we're going back to work now, it's okay. Things are going to be okay. There are still going to be cases of COVID-19 come up from time to time, but it's not, if you take these measures and really keep up the diligence that we've been doing, we won't see another cluster. So it's time to keep the economy.
We still get flus, we still get colds, we still get stomach bugs, you still get chicken pox. But it doesn't mean it's a new normal. Now, one last thing that I'm going to bring up and not give you the opportunity to respond to it, just because I think it'll be fun and leave us with something to talk about next time. I think it's really interesting how all these people are saying that they're going to refuse to take the COVID-19 vaccination when it comes out. Thank you very much, June. You're not hearing this. Thank you very much for tuning in, ladies and gentlemen. We'll be right back after this break.
All right, girls.
Mom, you said his plate again.
Workplace injuries hurt the most at home.
And welcome back to Out of the Fog. Here we are, joined by Brenda O'Reilly, the lovely and talented. How are you?
I'm good, all things considered. How are you?
I'm going to use the exact same phrase. I'm good, all things considered. So, Brenda, thanks for taking the time here. We're talking about the reopening of a lot of types of businesses. And of course, you've got your fingers in many a pot when it comes to businesses across our city and our province, really, especially in the downtown core, food service, beverage service, brewing, you've got a lot going on. So I don't think it's necessary for us to talk about, oh, poor me, my business isn't operating over the last number of months, because now there's anybody else's. So we all know that those types of businesses have been suffering. But it looks like we're getting closer to being able to provide more services and open up a little bit. And just to give people who are paying attention real world examples of the way restaurateurs or any kind of an entrepreneur are going about protecting the clientele that will be coming in here.
Right, exactly. So we've been working on this now for quite a while. Actually, when COVID first, around St. Patrick's week, because we weren't forced to be closed then, so we were allowed to be open. But of course, my spidey senses were going off, hang on now. And then we had the first case that weekend in the province. So we were starting then to go, okay, how do we still be in operation with this potential threat out there for our public safety as well as the business? And so we started to really research it then and started to look at best practices for operating in COVID times. So, of course, I'm members of a lot of organizations that are doing the work, that kind of work too, for their membership, Board of Trades and the Hospital Newfoundland Labrador and Restaurants Canada. And, so all those groups are, working together with their membership to put best practices. And of course, now you can look at best practices around the world. We're not the first place to have to deal with this, and not going to be the last. So of course, we've been doing our own policies. We've been open at Yellow Belly downtown. So we do have 4 restaurants in the city. Only one is currently open doing anything at all, which is the Yellow Belly downtown. So we're doing curbside pickup and delivery. So we've been doing that now for 6 weeks, we'll say. And, so we've had to already practice.
Are you also selling your beer out of there? Is it food and people taking growlers and stuff? Or okay?
Not growlers. Growlers aren't permitted right now because of, you got to bring in. So it was all out to the door, nothing coming in.
Okay.
Fair enough, right? So, but we're doing our bottled beer and stuff like that. And of course, now we're allowed to deliver and take away alcohol and wine as well. So we do have those offerings on our online ordering. That was new. That was something we had to get used to doing too, because we weren't an online platform because we're an in-house business. And so we had to quickly kind of figure that out and pivot to that. So that was, you learn something out of everything, right?
And it just makes you more nimble, right? Because this isn't the last time that for some reason or another businesses are going to have to close. It'll happen again, right? So at some point in time, and now you're more nimble. Now you can adapt faster because the work is put in kind of ahead of time.
Yeah, for sure. And, the restaurant industry has always had really good, strict cleaning, sanitation protocols. So, so of course the physical distancing and the flow, making sure people are at physical distancing, entrance, exits, spacing and pacing and washroom access and, those kinds of things take a little more thought, but they're all doable by all means.
Yeah. So, when you actually open up your doors and people can come in and sit down and order and eat a meal in one of your places, if I am that patron, what can I expect to be different?
Well, we're only taking reservations only, or if you come without a reservation, there will be a sign saying, please call, we'll arrange for your time to come in. So we'll coordinate and organize pacing and flow so that we're keeping people in the.
I guess it has to be a reduced capacity, right?
So we're lucky at Yellow Belly in the sense that we are a big building, so we can space people out a little bit more than most. But as long as they let that be based on your physical distancing and not maxing it out at a capacity. So I'm hoping, we haven't heard yet what it's going to be, but I'm hoping that every business will be able to have it work best for their business, which is, you know, the physical distancing, if that's the rule, which it seems like it's going to be, then let that be the rule and don't cap it to a capacity, because
some people have bigger buildings. It just doesn't make sense. Yeah.
Right. So, you know, and everybody's business then will work based on that same requirement, right? So yeah. But there'll also, you'll see the staff will be practicing, you know, more distancing. We will have masks on staff, on hand for the staff. We're not quite sure. We haven't heard exactly what the directive is from the chief medical officer yet to exactly what we have to do. But we're thinking and looking ahead and preparing for worst case scenario. So I'm not quite sure, but like, you know, it's all about, from what I can understand, from what I'm reading, and from what I'm hearing, it's all about social distancing, or physical distancing, I should say, and duration and density. So, you know, outdoors will be great, right? So patios should work well, you know, because you're not in a room. Now, at Yellow Belly, we do have a proper air ventilation. Our air comes in from the outside in our ventilation system. So, and then opening windows and doors. So fingers crossed, everyone say the prayers that we'll have a nice hot summer.
Yeah.
So we can open the doors and let her go.
You mentioned the patio thing. I'm hearing rumblings about the whole Water Street thing, and about it being sort of like foot traffic only, and about having stuff like that. I mean, you could really make like a community garden on that section of Water Street, like, because there's a restaurant right across the street from you guys. There's more down the street. There's like, you could, if you turn that into all walking space, now you're outside. And like now, I mean, is there a way to do that? Like, are people talking about that?
Of course. I mean, the mayor mentioned it the other night, and I have spoken with the mayor. You know, I've been advocating for Water Street, not only just our section. You know, Water Street's a big street, but Water Street to be closed for years for pedestrian traffic in the summer months, for that more of that social activity, and more of a, you know, when you travel to Europe and you go to a place like Italy and Spain, they have these campos, you know, so we haven't designed our city like that, but we can have areas.
We never designed our city. We never designed the city first or last.
Apparently we had it designed, but some way along the time we ruined it. I don't know. I see those pictures from 1964 and I'm thinking, why did we move from that to an industrial looking space? I'm not sure. Anyway, but all that aside, we do have, like, George Street has been closed to vehicle traffic after noon for years and years and years.
Yeah.
So we've never really made the best of that situation, because they kept us controlled to our little space in front of our buildings, as opposed to letting the sidewalks be public gatherings and let the street be walking areas. And so I vision that much differently than is what you see. And we've been trying to work on a George Street plan forever and a day. And if we had to get that going on, it would have been glorious for a long time ago. But it didn't happen. And, you know, we don't own the streets. We can only suggest.
What's your sense? What's your sense from the city, though? That do you feel like they want to be able to make it easier?
Of course. I think everybody realizes what's going on. I mean, we've been in a sluggish economy for a long time.
And last summer, your section of Water Street was dug up, right?
Last year and the year before, we were under the big dig. Then we had some again. So we've had a lot of things going on that's affecting not just downtown, businesses in general. But downtown's been a little bit more hard hit in the last couple of years. And like now the new sidewalks in this renovation that they're doing looks like it could lend itself to be more social.
Yeah, because they're coming out sort of like right in front of your place. There's like it comes out there. Yeah. And
last year we were able to put a bigger patio out front. Like there wasn't a patio in front of our building before. And last year, because our sidewalk was wider, and Craig went, oh, my partner, he goes, wow, look at this. Maybe we should apply for a patio. And we did, and they didn't turn us down. So it's not like we got special favor. We just actually applied and they didn't say no. So So that was good. And so there could be more of that. And certainly I think there should be more free flowing. But it's not just about the city though in this instance, because if we're going to do the sprawl onto the street, which I'm in favor of, as long as we still are able to get some curbside and delivery still going on somehow. We'll figure that out, because there's always a way. When there's a will, you can find a way, right? But it's the NLC and the government will have to come on board with this as well, because your license won't permit that for alcohol, but of course we need that. So they'll have to work in collaboration to make this happen.
There'll have to be sections there where you would have to be age identified for, probably.
No, they're all restaurants, so you can, as long as you're with your guardian, you can be in there, because these are not bar activities now. This is restaurant activity.
That's true.
Right? So like, no, I mean, you as long as you're with a guardian in an alcohol establishment, you're allowed to be in there. So as long as you're a restaurant, which we all are right now, right? But we welcome everybody. I mean, absolutely. I think it'd be a great experiment. I think this year we can try whatever, because we need whatever to happen.
Yes.
If we're not letting CFAs come in and we're relying on each other, then we need to throw caution to the wind and try something new.
Yeah, but you know what? We're hardy people. We can dig deep and we can move forward, and we'll all be okay. Thank you very much, Brenda, for giving us some insight into how some things are going to look, both in your places towards downtown and across our city, and probably the rest of our province.
Mm-hmm.
Thank you very much. And ladies and gentlemen, we'll be right back after this.
Call the Rogers TV viewer response line, email us, or connect with us on social media.
Welcome back to Out of the Fog. Well, folks, there you have it. As we move a little closer to level 3, as things start to loosen up a little bit, it's going to be some people going back to work. It's going to be some people going out into public spaces, maybe getting to go to a restaurant. Wouldn't that be incredible? And here's a couple of industry professionals who are giving us some idea on how to make that happen and make sure that we're safe. I'm glad, I'm happy, proud to have been able to give you some of this information. I hope you enjoyed it. I hope you have a great week. Stay safe, and we'll talk again soon.
Call the Rogers TV viewer response line, email us, or connect with us on social media.